Several years ago, there was a lawsuit on the bill, Mr. Speaker.
On the bill, Mr. Abinanti.
Thank you. Several years ago, there was a lawsuit, Silva versus Pataki. It was about the power of the governor vis-a-vis the legislature. And the court said that we have an executive budget system. The governor proposes the budget, and we can make some minor changes. But if we want to do something serious, other than cut, we need the governor's consent. So despite the significant efforts of committee staff and the Speaker's office, we have a budget that really reflects the attitude of the governor towards people with disabilities. And over the last few years, I've noticed this governor's attitude has gone from benign neglect to active abandonment. So I want to thank the staff for working so hard. I want to thank the Speaker and the Speaker's office for working so hard. But we certainly don't have a product here that we can be proud of. I share the concerns of my colleague, who's the chair of the Mental Health Committee. I share the concerns of my other colleagues about the failings of this budget. You know, the governor presented us a budget that was cutting $60 million from OPWDD. That's a 1.2% cut. And you might say, what's the big deal? Well, the numbers I heard are there's some 20% more people who want the services of OPWDD over the last couple of years. And we're actually cutting the budget. Now, the staff worked hard, and we were able to get some things put back in the budget. We saved the Research and Development Institute on Staten Island, but the governor priced that at only $1 million. But that gives you a feeling of his attitude. If he's going to try to save $1 million in a $200 billion budget, it tells you what he thinks of people with disabilities. We also restored $20 million for care coordination organizations, CCOs. We restored $12 million for local assistance payments. We held the Medicaid rate flat. We had to restore that money. And we provided $26 million out of a $5 billion budget, $26 million for a cost of living increase for those who work in the voluntary sector. Now that's 54,000 people, many of whom are getting paid $12.50 an hour. That COLA is 1%, and the governor wanted to cut it. 1% at $12.50 an hour is 12.5 cents an hour. So these hardworking people are getting $437 a week, $22,000, $23,000 a year. And we're going to give them an additional $227. That's where, as far as we got. We all know that our most vulnerable can't take care of themselves. That's why they need the OPWDD assistance. Oh, what about resources? Well, the governor has changed things so that every person who uses OPWDD must be on Medicaid. And Medicaid limits the amount of income you can have and the amount of money you can have in the bank to something like $1,000 or less a month. So a person living on $12,000 a year can't possibly have a reserve and needs every penny they can get through the OPWDD system. But we're going to have more people year after year with less and less money, all of whom are forced into poverty because of the governor's requirement that they must have Medicaid. You know, the end result of this is we have 9,000 vacancies in jobs in the voluntary sector. Nobody wants to work for $12 an hour in these very stressful jobs. And we have right now 5,000 people waiting for a place to live. And we've got 1,500 vacancies. Not enough for the 5,000, but why do we have 1,500 vacancies? Ask the voluntary agencies, and they'll tell you because OPWDD refuses to fund those vacancies. So nobody can move into them because there's no funding stream to fill those vacancies. So that's 5,000 people waiting for 1,500 spots, which OPWDD refuses to fund. And there's no money in this budget to do that. We in our budget put a little bit of money in, but it didn't survive. Do you realize that people with disabilities who live in the homes and the residences run by the state of New York don't even have access to the internet? While the rest of us are talking to family and friends and maybe taking classes on the internet, they can't do that because they don't have access to it. We put in $900,000 in our budget, and so did the Senate, and it didn't survive. So we're going to leave these people incommunicado without access to the outside world, especially during the pandemic. Now, there are a few little dollars in here. The governor managed to set aside some money, $31.6 million for the minimum wage. Doesn't that tell you something? We have to put money in so that we can bring the lowest paid workers up to the minimum wage and then give them a 12% an hour raise. Doesn't that tell you how this system is being treated? And the governor recognized we needed more independent living opportunities. So he put $15 million in. $15 million in a $4.9 billion budget. Last year it was a $5 billion budget. Now it's $4.9 billion. So as I said, this is an executive budget system. So we've done what we could. But let's understand who's in charge here. Let's understand who's driving the train and how slow that train is going. I think it's going in reverse. It's the executive branch that makes these determinations. We do the best that we can, even though we're supposed to be the policy branch. So we do the best that we can, but it's the governor's office. So once again, as I said, we have a budget that's active abandonment of our most needy. Now, Mr. Speaker, I know the two previous speakers or a couple of the speakers said they're going to vote against the budget. I really do think we have to have a budget. So I'm going to vote yes on this. But I want the world to know, I want New Yorkers to know why our people who are most vulnerable are not getting the service they need and that they deserve. And I'm not going to stop complaining about this. And that's what I'm doing. I'm complaining on behalf of people who can't talk, who can't complain. I'm going to keep complaining until the next budget. Governor, why are you doing this? There's one final point. The OPWDD agencies were hit very hard by the pandemic. You will see that the rate of take-up of COVID is greater than the general population. It's not as high as the nursing homes, but it's higher than the general population, and it's higher than the population of people in OPWDD who live at home. And the rate of death is significantly higher than the general population. And the voluntary agencies did what they could do. They didn't have PPE, they didn't get support, and they were told if you don't have staff, have your exposed workers come to work. So everybody else in the state of New York, I mean, my son was sent home from school several times. Why? Because he was exposed to one of the teachers who had COVID. He never got COVID, but he was sitting home because he was exposed. But those people who care for those with disabilities are told, go to work, then go home and quarantine. Oh, so it's okay to infect people with disabilities. But make sure you don't go on the subways, don't go near other people, just go home, quarantine. So we see that people with disabilities in the eyes of this executive branch are not worth, I wonder if they're worth 3/5. Where's Mr. Barron? Maybe they're 3/5 of a person. I want to suggest to you that every person, no matter what color, no matter what creed, no matter what background, no matter what ability, is a person and deserves to be helped. And so we have sitting out there right now $1.6 billion given to us by the federal government in excess Medicaid, excess FMAP, 1 billion of which is because our voluntary agencies billed. That was the 6% increase due to the services that were given to people with disabilities. And the last I heard, the governor was trying to take that money, not put it into OPWDD, not reimburse the voluntary agencies for the $500 million worth of extra costs they had, but use it for something else. I'm still waiting to hear how we're coming out on the revenue plan. I'm hopeful that maybe some of this at the last minute will be transferred over to help people in OPWDD. But given the way the executive budget came down, and given the resistance to the things that we want to do, I am very, very doubtful that that money will be available to our most vulnerable. So I will vote for this budget, but I will make sure that every New Yorker knows that this governor has abandoned the people who need our help most. Thank you, Mr. Speaker.